Good evening, everyone. I will call our work session to order, which is being held virtually via WebEx of January 26, 2021. We have two items on our work session agenda, and the first item will be 15 minutes, and then the second item will be an hour. The first item, I'll just pass it to our City Manager Rodriguez, and it is the Metro Transit Manager of Route Planning, Cindy Harper, is going to be with us and give us a brief update about the Orange Line BRT and the connecting bus route study.
Thank you, Mayor. And we have a very full agenda, so I'm going to pass it immediately to our City Engineer, Joe Powers, to introduce our speakers from Metro Transit.
Good evening, Mayor, Council members. Joining us tonight are Cindy Harper, who is the Manager of Route Planning for Metro Transit Service Development, and John Dillery, who is the Senior Transit Planner and Connecting Bus Study Project Manager for Metro Transit Service Development. They prepared a quick presentation for you tonight, and they should be able to share their screen there. I see John just popped on, so enjoy and please ask them any questions you have on their presentation.
Good afternoon, everyone. Are you able to hear me okay?
Yep, we can hear you all right.
Okay, great. Thank you for the opportunity to present on the upcoming Orange Line Connecting Bus Study. My name is Cindy Harper. I'm the Manager of Route Planning, Metro Transit in our Service Development Division. And with me this evening is John Dillery, who is our Senior Transit Planner and also is the project manager for this project. So I'll cover the first couple of slides that talk about a little bit of background, and then John will get into a little more detail about the changes that specifically are impacting the city of Richfield. So just 1 second to pull this up on the screen. All right. Is everyone able to see this?
Yep, we can see it.
Okay, great,
Yes.
Perfect. All right. So the Orange Line process initially started back in the fall of 2019, but we had to put it on pause due to the COVID and then restarted the process again last fall. And now we're ready to bring our proposed changes out to the public for feedback. First, just a little bit of background on the Orange Line itself. The Orange Line will substantially replace most of Route 535, and there are two stations in Richfield, 66th, 76th Streets. Will feature all-day, frequent daily service on 35W between Minneapolis and Burnsville. The project is under construction and scheduled to open later this year. So here's a quick reminder of our project goals and our study areas. The map on the right shows the Orange Line, of course, in the middle. And there are 11 bus routes in blue that are shown here. These are key routes that will have changes proposed. In addition, there's another 5 or so bus routes here shown in heavy gray. These are routes that will also connect with an Orange Line station, but don't have any changes proposed to them. In order to maximize the extent and the access of the benefits to the new Orange Line, our goals included making sure that we connect more than 50,000 jobs outside of downtown Minneapolis with this new corridor, and prioritizing those who rely on transit the most, including low-income communities and Black, Indigenous communities of color. And then, of course, as always, we're looking to simplify our routes to make them easier to use. On the right is a map of the proposed, on the right is a map of the proposed route changes, which John will get into in just a minute. However, since we still don't know for sure what the transit market and travel demand will be when Orange Line opens, the concept plan is going to have two scenarios. Scenario A matches the resources we have available today. Scenario B reflects pre-pandemic level of resources. If demand returns, we could reinvest some resources into scenario B. Scenario A meets the goals of replacing local service that's not covered by the orange line, currently operated on Route 535, and also improving connectivity between the orange line and various jobs, Normandale College, and other key important destinations. Scenario B builds on this by improving span, frequency, and days of the week that the routes serve the study area. And I'll pass it to John.
Okay, thank you, Cindy. I hope everybody can hear me okay. The first routes, the key route changes in the city of Richfield involve 66th Street, 66th Street Station. The orange line is stopping at exactly virtually the same points that the 535 does at 66th Street. But we're taking the opportunity to look at Route 515, your main crosstown on 66. The concept plan simply simplifies the route into one line between Southdale, 66th Street, Cedar Point Commons, Bloomington Avenue, and the Mall of America. What this does is it improves service levels substantially with good convenience, consistent service on Bloomington Avenue. But to do that, we rely on our extended Route 7, shown in green, coming down from the north, from the Nokomis East neighborhood in Minneapolis, and connects with the 515 at Cedar Point Commons. The people going to VA Medical Center, though, would then have to take the 515 to the blue line for rapid service from Mall of America to the VA. Then we have some service that's been running on Longfellow Avenue on the east side of Highway 77. Would all be brought over and consolidated on Bloomington. So that's the changes on 66th Street. Its service could improve under scenario B. The next slide is the other side of things. For the 494 Frontage Road 7776, we are replacing pieces of Route 535 here, as Cindy mentioned. That's an important goal. It serves local destinations in Richfield, Penn Avenue, 76th Street, 77th Street, Glendale. The 540 is improved and simplified into one direct route on the south edge of the city. Connects to 76th Street Station. The other key thing I want to mention is both routes 515 and 540 are planned to use the new 77th Street underpass in the southeast corner of the city, and it gives better access to that corner of the city of Richfield. We understand that underpass won't be open for about a year after the orange line starts, so we'll use the current route shown in gray, use the underpass as soon as it's available. And that's basically the key changes on the city of Richfield. Thank you.
Thank you, John. So now our focus has shifted from developing the proposal to getting the word out about the proposed changes. And our public comment period started yesterday, extends for approximately a month. We are using a variety of approaches that are listed here, both virtual or online and in person. It's important that we make sure we hear from a diverse set of our riders, keeping in mind that right now, not everyone who is interested in transit is actually back riding transit. There'll be opportunities to give feedback at 3 different community meetings, as well as there's a survey on our website, along with the report posted on the website, and also via email and phone. Be happy to take any questions.
Thank you so much. So this is the end of the presentation, correct?
Yes.
Great, thank you. Do we have any questions from council members? And then maybe just speak up because I'm not seeing everybody on the screen here.
This is Councilmember Supple. I did have one question. You said you were changing the route for the people to get to the VA center. Is it going to make it a longer commute to get there, or just a different one?
Councilmember Supple, it is John Dillery. It does take longer to go by the Mall of America. The frequencies are good, the connections are good at a nice transit station, but it will take longer. It's one of the trade-offs.
Thank you.
Other questions or comments from council members?
Hey, Fred O'Leary here. Just had a brief question about going south from Richfield. I know the 535 serves Lindale and Bloomington now. Will that go away, or is extending the 4 contemplated?
Councilmember Hayford, excellent question. Thanks for the big map. Route 535 does serve Lindale Avenue in Bloomington, rightly so, and it does need to be replaced as a key component of that route. The Orange Line doesn't go there, so yes, we have a new route proposed called Route 534, which would link the American Boulevard station and Knox Avenue via Lindale straight down to 98th Street to the 99th, or the 98th Street station, as they're calling it now. And that would run 30-minute service in the off-peak, midday, evening, 20-minute rush hour. It's much more service, really, than is on the 535 today.
Okay, thanks.
Thank you.
Other questions or comments from folks? I just want to add that I'm super excited for this to come to our community, and it's going to be a huge asset to people not only in Richfield but across the whole region. And I saw Councilmember Whalen had his hand up.
Yeah, I was just going to briefly mention, similar to the comment you just made, I really appreciate, yes, the Orange Line itself, but the opportunity to revisit some of these crossing lines. I know when I was without a car for several months and trying to use buses to get east-west in Richfield, that was pretty challenging. And so I saw a couple of these proposals include increased frequency for some of these local east-west routes, which is huge. So thank you for looping this into the bigger project.
Thank you.
Great. Any last comments before we end? Councilmember Troutman.
Thank you, Mayor. I just wanted to thank everybody on the call, and then specifically just recognize I've just been excited for the Orange Line for many years as a great project, incredible infrastructure that's fully funded, and just recognize how challenging it is to build transportation infrastructure on data models that are now in the midst of radical change. And so I just want to recognize the challenge that is and appreciate your hard work, like so many people in so many industries are doing, in just flexing in the midst of reality that we have data models that have been built for decades that are now fundamentally different. And so I'm glad that this project's still moving forward, and I'm grateful for your work.
Thank you.
All right, well, thank you to our presenters. We are very excited for this update. We're excited for the Orange Line to come to our community, and we hope you have a great night. Thanks for joining us.
Great, thank you.
Thank you very much.
Absolutely, thank you. I will pass it to our city manager for the next presentation, which is going to be from our police department. We are really excited to meet our embedded social worker, also learn more about the Richfield Police Department Joint Community Police Partnership, and an update on the implementation of our body cameras. So I'll pass it to you, City Manager Rodriguez.
Thank you, Mayor. Thank you, Mayor. Last year, the council. I don't know why it's echoing. Last year, the council centered safety and equity at our goal setting. You prioritized continuing to provide services and keeping people safe during the pandemic. You also prioritized equity and building trust with community. Staff have been busy working hard to make progress on these priorities, and we have several updates tonight. And before I turn it over to Chief Henthorn to introduce the presentations, I just wanted to introduce, we have a new member of our staff, and I want to introduce Bill Green. He's our new Equity and Inclusion Administrator. Bill just started last week, so he's been busy meeting with our staff and our consultant and getting up to date on our last 6 months of work on equity. But Bill, can you briefly introduce yourself?
I will go check briefly on the audio.
Thank you.
Can you hear me now?
There we go.
There we go. Okay. Okay, let me rehearse this again. No, I just want to say good evening, and I really want to say thank you to our mayor and to the council again for the opportunity to be a part of this great initiative of equity and inclusion. I really have appreciated everything so far, and I'm really excited about working with the staff and the council. So thank you very much.
Thanks, Bill. And Chief Henthorn is here to introduce the presentations.
Thank you, City Manager Rodriguez. Madam Mayor, council members, we have 3 updates for you tonight. Donna Nelson, who's our embedded social worker, Patricia Iban, who is our Joint Community Police Partnership Liaison, and then I will give you an update on the implementation of the body camera program. I'd like to also introduce Monique Dreyer-Sutton. I think some of you remember she has been at study sessions with us before. She is also present tonight. So our first presenter will be Donna Nelson, our embedded social worker. So I'll let her talk about herself and give a little bit of background of herself.
So can you hear me?
Yep, we can hear you.
All right, well, I tried the video, but that didn't work. So I don't know if you're going to get to see me because I can't. I use Teams. This is a different thing for us. So.
Okay. Welcome, Donna.
Thank you. So I didn't know I was presenting on me. I was going to present on more what I do, but I guess I can tell you a little bit about me. Whoops, I just lost all of you guys.
We can still hear you though. A little bit about you and what you do would be great.
Okay. So I have been a Hennepin County social worker since 1990. So I have been around for a while. This position with Richfield Police Department. So I'm joint between Richfield and Edina, and that started on August 31st. So we're into my 5th month, end of my 5th month. Part of it was figuring out where I was going to work, what days I was going to work where, and kind of trying to figure that out. With COVID, it's been kind of difficult in terms of, my hope was to be able to have more meetings with the group to get to meet people and to kind of discuss cases. That was kind of all of our hopes, and hopefully at some point in time we can do that. But right now I'm at Richfield on Tuesdays and Thursdays and every other Friday. So I kind of go back and forth between the two. But if I'm in Edina and Richfield, so everybody sends me emails, or I get most of my information comes via email. So it doesn't, to me, it doesn't matter where I'm sitting. If a new case comes in or a new situation comes in, then I deal with it. So I do have a counterpart. Her name is Lauren, and Lauren is handling all the group home referrals that come in, but they come into me and then I refer them on to her. And Richfield does have quite a few group homes, and you do have some frequent flyers at your group home that like utilizing police and fire department. So Lauren's had quite a bit of contact with them. The reason we kind of split it up, because at the group homes, all of those individuals usually already have a case manager or somebody already working with them. So it's more what's going on at the facility, what's going on with the individual, are the staff working with the individual aware of what's going on? So then she can kind of work more with them versus the individual. For me, it's more the police will send me a referral. So I've been getting a different kinds of referrals, and I thought I'd kind of tell you that, kind of how the referrals come to me, and then kind of what I've been doing. So I've been getting chemical health calls. Just started the last month and a half doing code violations. So I go out with Tim Mahoney on hoarding houses or issues around unsafe things. There's mental health. We have mental health and chemical dependency combination, child protection cases, which I don't do a whole lot with because they're usually already involved with somebody else. And my department is adult behavioral health, so we try to focus more on the adult. Doesn't mean that I can't address a child issue and check in with the family and see if they have the resources they need, but we're primarily referring them on for sure. Also, I do a lot with Bloomington Public Health because that's sure who you guys refer to for like some of the adult protection cases, and I've been teaming with adult protection on a variety of different issues. Some of the cases are just pure medical cases. And most recently, this past month, the officers have been giving me homeless people that they've been finding, and so I've been giving them resources. So my referrals can come in from an officer. Brad set up Brad Drayna, I don't know if you guys know him, but he set up a crisis response form that the officers can fill out, and then that's sent to me. What I'm finding is happening more now that they all know that I'm actually in the building and what days. They're either sending me emails, they're calling me on my cell phone, or they're actually stopping by the office and just saying, hey, can I run this case by you? Is this something you can follow up on? Is this something you can help us with? With the code inspectors, I'm getting the emails saying that Timothy is going to go out. Do I want to go with? And so then I just put it on my schedule, and they've been really good at trying to coordinate it when I'm actually in Richfield. Doesn't always work that way, but that's kind of how we've been trying to do it when I'm actually in your city. I just got a referral from your crime specialist, Jill. And then the front desk love when I'm there, because if somebody stops in and has a question and they don't have a clue who to ask or what to do, they will come and check with me. The benefit of that, I've worked at the county forever. I am familiar with resources, and I'm a Hennepin County resident myself, so I kind of, if I don't know where to send them, I can email or call a coworker and figure out how to guide them to what they need. So with COVID, unfortunately, I'm not going out a whole lot. So when I get a referral or police report, I will call the individual. The individual has a right to say they don't want services. That's totally up to them. We are voluntary. If they don't respond to the phone call, I will try to call 2, 3, maybe 4 times, depending on how many other people and things I have going on. Then I will send out a letter, hoping to get a response from them. If they don't, then I close, but that doesn't mean that the person may not reach out to me a month later and say, hey, are you still available? Can you still help me? And then I can kind of help them with whatever resources they need at the time. I have done a few face-to-faces. I would personally prefer doing more, and once COVID restrictions are lifted, my mode of social work is I would make a couple phone calls. People don't respond, I'd be knocking on their door versus sending a letter and just introducing myself, because I think face-to-face contact makes a big difference. And it will depend on the day with the individual. For example, I got a case yesterday from one of your officers. A woman, there was an incident with her and her son, and they were getting evicted out of one of your hotels, and she had nowhere to go. Yesterday, she was not in a spot to talk to me and didn't think I could help her. I called to follow up with her today. She did find somewhere to go last night, and now she's receptive to me trying to help her find some additional resources, such as food, how to get stuff. So, which was really good. So sometimes they may not want to talk to you that day. It's following up with them the next day. If individuals already have a case manager or someone from the county or community provider working with them, I will follow up with that community provider and let them know that their individual has had contact with the police, and kind of give them a heads up so they can follow up with that individual and then try to figure out what's going on. One of I think the difficult things for some of the officers is because of HIPAA. I am not allowed to say what I'm working on with an individual, or if they have a case manager, I'm not allowed to give that information unless the individual gives me permission. We are accepting verbal consent at this moment since we aren't seeing that many people. So that helps. And sometimes I have individuals that have called the police a lot and they want me to tell the police that yes, they are talking to me, so that when they call again, they can say, yes, I talked to your social worker, or but I still want you to do this, you know, that kind of thing. And I think it's helpful for the officers to know that I'm out there, because that way, if they keep seeing that individual, they can say, hey, we're still having some issues. Do you know what's going on, or how can we work together? Ideally, at some point in time, we can go out together on more things and do more joint work would be my hope in terms of initial introduction with the more of the mental health stuff. But I guess we have to see what happens. My role is to be short-term, not long-term. So it's seeing what the individual needs, figuring out what resources are willing to accept. Sometimes it's just referrals to food shelves, or to give them the hours for food shelves, or, you know, housing. Housing is so tough right now, though, so, and we all well aware of that. So that one's a tough one, but it's still, it's whether or not they want a case manager, whether or not they want a therapist. It's kind of where they're at in terms of what they want, but it's at least trying to make that referral for them. And if they're not eligible for those services, try to figure out another way to help them access those services through a different route. So that's kind of in a nutshell what I do, who I am, and I apologize that you can't see who I am. That's technology, I guess. Does anybody have any questions?
Thank you so much, Donna. Any questions or comments from council members for Donna? Councilmember Whalen.
Yes, thank you, Mayor. I'm curious, I know kind of and you described this, the nature of the work is that certainly there are some people who it's not realistic or appropriate to think that your role would prevent them from needing emergency services in the future. But in some cases, I think that is the hope. And I'm curious if we, both to that end and just in general, since this is I know it's not a new idea, but it's new to us, are we measuring like how many referrals you're making, if it impacts the number of repeat calls we get for similar issues? I don't know how possible it is to track that, but I guess I'm just curious if there's obviously going to be anecdotal stories of this making a positive impact for people, but personally with the long-term goal of I'd love to expand this work, and I think that it's really important. I'm curious if we are measuring it in ways that can tell the story of what impact it has.
So I can't speak for the police department, but and I apologize, my supervisor was going to come because she's the number person. I have a database that I have to fill out. I fill out every referral that comes in, what type of a referral it was, like was it suicidal, was it a mental health one, was it a medical issue, kind of the reason for the call. And then I also track whether or not I was able to make contact with the person via phone or if I sent a letter. So we kind of do that data sheet, but then we also have another data sheet that we're doing. What kind of referrals am I making? So if the individual is working with me, what have I referred them to? So what kind of resources were your individuals looking for? And that is broken down by each individual I have contact with. So they are tracking those kind of numbers. The glitch we're kind of running into is, and I agree with you, because to me, my job is to reduce the amount of police having to go out on non-emergency calls for the people that just like calling and talking to the police. There are some individuals I know that I have talked to weekly and they are not having any contact with the police because they are calling me weekly. And if they are calling the police, they're telling me why, and it's a reason that they should be calling the police because I can't do anything with that issue. I think the other part is that the officers don't know if we are involved because the individual doesn't give us permission. I'm trying to figure out how we're going to be able to track how to let, if they're continually calling and we don't know about it, because if they're just someone that just calls all the time that doesn't really make a report, then how do we track that? How are we going to work through that? So I think that's one of the things we're going to try to work through. Because if they're continually calling and they're never stopping and we don't know that each other's, and they don't know that I'm working with them, then it's not changing their status in terms of reducing the frequency and misusing 911. Did that make sense? Does that kind of address what you're asking?
Yes, thank you. And I think the maybe trickier question that at some point, I'm sure it becomes harder to measure, and certainly the privacy impacts it as well. But just the question of, I mean, the sort of the success story that we hear about with these kinds of programs when they're proposed is someone who is not receiving the resources they need. And so their situation, whether it be any number of different needs, that it becomes a repeated crisis that they need to call emergency services for. But if we connect them with longer term resources, that is not needed. And I guess I was curious if there's any way to track that type of situation.
I think that's a great question, and that's something I can propose to my supervisor. Like I said, I apologize, she wasn't able to make it. Something came up and she wasn't able to be here. Because I think that's a valid question. You know, I mean, are the citizens in the community getting the needs met? And so that's making them better. So they're utilizing the police and fire less frequently because they're getting other services in place. Because ultimately that is the goal, but yes, how are we going to measure that? I think that's a good question.
Thank you so much for that.
Councilmember Whalen, I can address it from the police department standpoint. Sorry. With Donna on board now and the referral that she's talking about, that was adapted through, different departments that have the same program. And as Donna came on the department and she started getting the referrals, I think to answer your question a little bit further, I think where we're going to see an impact is with the people that we're dealing with emotional and mental health issues when it comes to hoarding. We're starting to see a drastic increase. And sometimes what happens is when officers go there, all they'll do is they'll get them the services through COPE. And we never necessarily know what happens once we call COPE and they come in. We don't get that information, but we'll probably get that information through referrals in dealing with Tim and the inspection staff to see, okay, what services have they received? How are they getting help, and how are we cleaning up the property? And I think that's probably going to have a bigger impact quicker than maybe some of the other cases Donna's talking about where you have involved, and we just don't have access to that data. So.
Thank you, Chief. Council members.
I wanted to talk about the hoarding issue, and I was really pleased to see the wide variety of ways that you can help people. But I know it has been a concern because there were people that were being served with eviction notices because of hoarding. So if we can help deal with the underlying issue, we can prevent some homelessness. And so I think that's another positive effect of the services you're providing. Thank you.
Thank you.
You're simple. Any other comments before we move on to the next item? All right, thank you so much, Donna. We really look forward to working with you. And I think, as you can hear from the council, we're really interested in the direct services work you're doing, but then also how can that inform helping us better understand what the needs are long-term and how we can support the community to meet those needs. So we hopefully look forward to meeting you in person someday sooner than later.
Thank you.
Thank you. And then I'm not sure who will take on the JCPP, if it's Patricia or Monique, but I think that's the next item.
I'll introduce Patricia Iban, who's been with us for several months. We missed her in the building for a long time because her job was to help those that are unsheltered when COVID hit. So I'll let her talk about herself and talk about the program.
Thank you so much, Chief. Thank you, Mayor and council members. I think we have a presentation around there, but I can start if we don't. So I just want to talk a little bit about GCPP, Joint Community Police Partnership. As a mission, we have enhanced relationship between police and the community, including immigrants, people of color, indigenous people, and faith-based communities. The goal is promote effective crime reduction while build public trust. The 6 cities participant in this program, are Bloomington, Brooklyn Center, Brooklyn Park, Crystal, Hopkins, and Richfield, of course. We have as a 3 key elements, embedment of the community liaisons in the police departments, establish police multicultural advisory groups, the PMACs, community programs and training. And then as a community liaisons, we act as a bridge between the police and the community, embedded in the police department as a Hennepin County employees, as Donna was talking about that too. So we have more contact with the Hennepin County resources to provide to the community too. And then facilitate and lead community meetings, organize events, and train to both police as well as the community. Identify local community organizations, identify local community leaders, formal and informal, build trust in the community, identify local human services, listen to community needs, connect services to community needs, and then community gatherings and trainings with churches, social service agencies, schools, homes, apartment complexes, town halls, forums, questions and answer sessions with the community, and participate in community academies. And then I think one of the most important parts, and everybody I think is waiting for, is like what we have been doing in the last 10 months. So first, as a joint community police partnership liaison, I was trying to connect with community, but first be mindful to connect with the police department. So I had been in 23 ride-alongs with officers who, like, that was an eye-opening for me, because it's really different. Try to think about the police department job when you are in the other side and when you are a community member. Just to see how the calls go or how the movies work is so much different than when you are in the car attending call after call after call with the officer. So that was amazing for me. And then I was with 20 meetings directly with investigators, lieutenants, administrative personnel, and participate in the crisis intervention training, giving information to the officers about GCPP. For some of them, were just like a refresh or reminder about GCPP, and for some of them, because it's a lot of new officers in the department, that was just the eye-opener, like what we can do with GCPP. And then establish relationship with the community. I had been attend to different events, like 3 events. Some of them we were participating, and some of them we were sponsors for them. The first one was a census information session with the participation for 12 families, mostly Latin families, but some Somali speakers, some Somali families too. So that was interesting to see. And then we went with an event organized for the multi-family housing for City of Richfield, event in Richfield Tower, distribution for COVID-19 care kits. So that was amazing, just to go and knock in 150 doors and see the excited for the people just with a little packet with face masks, hand sanitizer, and disinfecting wipes, and see how happy the people was just with that. Some of them maybe they didn't have the money or the resources to go and buy it. So that was really touching event, and then introduce myself with the community too. And the last one was in January 9 for the 3 Wise Men event. That was with the participation, maybe more. They're still counting because that was a lot of people showing in there, and a lot of people who maybe was able to get toys. But we say that was more than 250 kids, youth, and their families. So that was a really good event, and we were sponsoring there. Additional, a straight relationship with our community. I plan 3 virtual events. The first one was a presentation that was like community liaison for Richfield Police Department, with the participation for one of the officers, Officer Esquivel. And we say presentation, but that was more like interview, back and forth questions for more than 1 hour about GCPP, about how the Richfield Police Department is answered right now in this crisis moment with everything, and questions for what the community can expect when they call 911, what they can expect when officers show up in their house, or what they can expect when they have a stop, traffic stop. So that was really interesting, and I think people are still watching that videos. And then for October, for the Domestic Violence Awareness Month, we did a resource fair with the participation of 12 organizations and 2 faith communities. And that was just for the need. In Richfield, many cases of domestic and sexual abuse got underreported because of fear or lack of support, financial dependency. And this year, the statistics were showing a significant increase of 29% increase in the calls compared with the last year. So that was a need in the community, and we need to at least give different resources to community members to know what they can do and what resources they have in the community. So that was a really good event. With the participation for 1,384 participants / viewers. Now we need to talk about viewers, how popular we are or not. And then planning time approximately for 140 hours. And I touched that because sometimes, maybe because we are learning this new process and this new word, but it's important to see like the difference when you have a like in-person event, you start like planning, and of course you put a lot of time, but when it's online, it's a lot the back and forth between the people, like everybody have the same information, so then when we're going live, everything look like easy and going through there. So that was really interesting. And then capacity development. We provide resources, train community members, and develop tools. So I was helping with interpretation for 17 Spanish speaker families between officers, residents, and support staff, and then help with Spanish speaking translations for different forms like data request form, complaints form, flyers for the crime reduction for hotels and motels, and any additional material we need for events and for activities. Okay, that presentation will help me, but no. Now we also build collaboration with agencies that provide services on food security, housing, domestic abuse, prevention, etc. So I have been join different networks as Ready for Richfield, Mujeres Latinas Unidas MN, and Latinas Expo. And with all the events and all these groups, I had been in contact with meetings with 163 people looking for potential community partners to work in different activities and support events too. Okay, and then one of the topics everybody, I guess, is excited about is the Police Multicultural Advisory Committee, the PMAC. And me too, because that is a group of people helping in my job and giving me a little hand in all the activities and helping me with volunteering hours for activities and all this stuff. So the PMAC is a diverse group representing many different ethnicities, nationalities that live, work, learn, or worship in the community in Richfield. That have monthly meetings, member host community meetings in company with me. So of course I will be the host, but it's important like for the community, like the members, like the PMAC members, to be a part and be involved in each meeting too. So the idea is like it's rotation for them too. Assist in developing cultural training for officers, provide prospective suggestions and assistance to the police department on issues in the community, ensure that community members are informed about the police and share police message with the residents. Our goal is to host the first PMAC meeting in the second quarter of 2021. So right now, I have been recruited BPAC members to serve on the community. And I think the most important part for this is we want to be intentional. We want to be intentional with what is the people we want in the PMAC. We want absolutely multicultural community reflecting the community in Richfield. So I will say that will be so much easier if we do a open convocatory and get in the work and interview people and community. But it's true, most of the minorities don't go into that opening convocatories. They don't apply. So I think the best way to do it is going and knocking the door, talk to people. If they cannot do it, going to the other person who maybe they know, and there are like important members in the community and people see them as a leaders. So yeah, I had been doing that. We already have a couple applications and we already had been distributing some flyers for them to know exactly what they can expect in the meetings and what they sign for it. And this program will work in concern and parallel with the Equity and Inclusion Administrator, of course. So Bill, we need to talk a lot about this. Okay, some other stuff. I had been working, hold on a second. Okay, sorry. I don't wanna miss any information for you guys. Okay, so one of the staff the GCPP does in helping in the community is roll call trainings, day-long trainings for officers, facilitate community dialogues, host question and answer sessions, present in community events. So I already talked about that. and familiarize officers with culture community norms. The outcomes are increased positive interaction between the police departments and multicultural groups with Richfield community, a strength partnership with key stakeholders to support with the access to community services, develop programs with local partners, develop and implement a communication strategy to meet the needs in our community. Additional activities I have been doing, participating more in monthly meetings with the GCPP team. So of course, we want to know what the other cities are doing, and we want to share what we're doing and give like ideas. I think it's more that, and when I have an idea, sometimes they start like giving me more information, or, oh, how about you do this or you do that? So it's important to be connected. I serve in the panel for the new GCPP liaisons with Brooklyn Park and Brooklyn Center. And also I was part of the panel for the Equity and Inclusion Administrator position for City of Richfield. I think that two things are really important. We put information on or our point of view in that panel interviews, but that also teaches a lot. So that was really important for me to be there. And as the chief say, I was part of COVID-19 response, so helping at isolated sites. That was interesting just to see the process of moving seniors and medically vulnerable people experiencing homelessness into hotels from shelters to reduce the risk of infections for COVID-19. Try to help them giving the food or just talking to them or giving resources, and then now see a lot that community going to a permanent housing, being in a independent living. So that is really feeling for me. And one important part of that job was like Donna had the opportunity to be here for 20 years. I just begin with Hennepin County. So that was a really good opportunity to be in a different networking and get a lot of information, a lot of resources for residents with probably I will work and I will use and I will refer to that Hennepin County employees. And then I was...
Oh, yeah. Sorry, excuse me. I'm wondering if we could wrap up because I want to make sure that the council has time to ask you some questions, and then we can also review the body cam items. So I don't, is that possible? Thank you so much.
Yeah, no, that was
what you've been doing.
Yeah, no, that was mostly the presentation. So the last one was like just working with essential services for COVID-19. So yeah, if somebody have any questions, please.
Thank you so much, Patricia. It is unbelievable how much work you've been doing in the community. How to pivot.
I was trying.
Of COVID. Wow. Any questions about JCPP and the work of Patricia in Richfield from our council members? Councilmember Whalen.
Thank you, Mary. And thank you, Patricia. That is quite an impressive amount of work, even amid COVID. The specific question I had was around, and it sounds like maybe this is already happening. At one point, you mentioned the connections you're making with different networks and organizations. And then when you're talking about the recruiting folks for PMAC, I assume that those are overlapping and that you've been talking with some of the local organizations and those leaders to recruit. Okay. And then I also specifically, I know we don't need to get into the details, but I know there's been some turnover on PMAC, and maybe a completely fresh start is the best way forward. But one connection I'd hate to lose was Fu from the library. Was really great at connecting the department with the different cultural events that the library hosts. And so I think that would be worth, whether it is, if Fu is still interested or another librarian, but making a connection there would be worth doing. And my one question was, are you just to clarify, when you talk about being intentional, does that mean it is entirely a recruiting process, or are you open to, like, if people are interested, they should reach out, or what, kind of what is the process? I know we have residents who have been interested in the past.
Thank you so much. And yes, Fu already reached to me, and I heard a lot of good comments about her and the participation in the PMAC. So yeah, she was one of the ones I was like thinking about reach. I didn't talk to her again, but yeah, we absolutely want her in the group. And then about group, like yes, we are like try to reach different schools. Like we had been talking with the Mira, we had been talking with middle school, high school, the Partnership Academy. We had been talking about profit organizations who are housing in Richfield, and we like they have diversity in there, so we should have participation from there too. We are thinking how because yeah, we want to be really intentional. So we don't know exactly how we can do, but if you have somebody interested, like I think we can just see what is the information they can bring to the table, what is the work in the community they have been doing, and we absolutely can consider other people. Like I am still like open to listen to people who is really a good leader in the community, the Richfield.
Thank you so much.
Thank you.
If folks are fine, either ask if we could ask a pretty quick question, and otherwise I would move us on to the body cams. Is there any last quick question for Patricia? Councilmember Troutman.
Thank you, Mayor. And Patricia, it's wonderful to meet you, if not in person, at least face to face. And I just want to say welcome, and we're so glad you're a part of our community and our team and public safety. And just a thought, as you're reaching out to those groups and communities, one group not to overlook is the Church of New Life, which was a historically Black church in Richfield, and they just moved across the border to East Bloomington. But I talked to Pastor Sam Nero just a couple weeks ago, and he's like, I want you to know we're a Richfield church. We've been there for decades, and they still really consider them. They have a lot of parishioners that are part of our community and are still really wanting to lean in and engage in Richfield. So just because they're on the other side of the border, he wanted me to make sure he's to know. And I've talked to multiple congregants that are looking for ways just to engage, just to be in part of the kind of conversations that PMAC I think has facilitated or could facilitate. So that would be it. I just wanted to mention that resource. But welcome, and we're so glad you're here.
Thank you so much, and I absolutely will, because I'm sure it's a lot of residents from Richfield who still going to that church. Thank you.
Thank you so much, Patricia, for coming and presenting to the council, and nice to see you again. And thank you for all the work you're doing. Nice to see you, Monique, as well. Thank you. We're very excited for your work, Patricia, and the work of PMAC and JCPP in Richfield.
Thank you so much. Have a wonderful night. Bye-bye.
You too. And I'll pass it on to Chief for our last item.
Thank you, Madam Mayor. I have to dovetail on the great job and work that they do for us, both Don and Patricia, during COVID-19. I mean, I know we're all battling different things regarding COVID, but for them to do the outreach that they've been doing is just unbelievable, that they're able to get out there and do the things that they're able to do. So moving on to the last presentation, I guess, last but not least, I'll share my screen here. And I'll give you an update on the body camera program. This is the implementation update of our body camera program. The implementation timeline, the city council approved in our budget in September 22nd for the money to purchase our body cameras. One of the important things was hiring a data media specialist to be able to manage all the data along with our IT specialist. So between the 12th and 23rd, we posted the position, got a lot of applicants, a lot of really good applicants. It was not an easy process. And so October 26th, we had applicant interviews. And we narrowed it down to roughly about 3. And then from November 2nd to the 16th, we had applicant background packets that we have to fill out because they're members of public safety, and we have certain things that we have to check off before they can come into the facility. Again, great applicants, great people applying. I did the chief's interview on November 23rd. And at that point, we picked Elisa Nordby, who comes from us from Maple Grove Police Department with a wide range of experience in not only records management, but data collection and data practices. And so we're great to have her, very happy. She's doing a great job so far. And then early December, a lot of the hardware came in for the body-worn cameras. In mid-December, we started hardware installation and training of our officers. Elisa started on January 4th, and so she had about a couple of weeks before we started to actually train on body cameras. We also, on the 25th, went live with our new data practices software, GovQA, and so that's going to help her. And then we've deployed our body cameras here effectively yesterday. It took some time. I'll go through some of the training we've had to go through and answer any questions that you have. So the body camera that we have is a WatchGuard 300, and the initial proposal that we got several years ago was for the WatchGuard Vista. And one thing we didn't see with the Vista initially that we saw and waited for in the V30 was some of these things. Obviously, it's built for law enforcement. It has the maximum endurance that we need. It has to last a 12-hour shift. Not every police department is on a 12-hour shift like we are. So we need to make sure that it's durable enough, it's going to last long enough, and it's going to operate out in the field. So we wanted to make sure that that happened and that you could easily swap the battery in the field. We wanted to look at maximum clarity. Some of the body cameras that we looked at, the View and some of the other ones that are out in the market didn't have the resolution that we wanted. It was a grainy picture, and we wanted to make sure that it was as TV quality as we could get. So it also has electronically adjustable lens for optimal aiming. And as you can see, I think on Facebook, that the officers will put the body camera right on the middle of their chest, and that's the most optimal place to put the body camera for viewing. So maximal usability, it has Bluetooth and Wi-Fi, end-to-end security. And obviously is designed, and I'll show you just a quick video here of what the camera looks like. Can you see the video? No?
I don't think see it.
Can you see it now? No?
Music.
Well, the music, but the video didn't work. It probably, when I shared my screen, it didn't work on top of the PowerPoint. So I apologize for that. But there's the back of it right there. It has a detachable battery. It easily changes the rechargeable battery, so officers can keep an extra battery in their car for unexpectedly long shift and extra shifts. So where the body camera is required. One of the things that we wanted to make sure that happened when we went to a body camera program, and one thing we couldn't find and we searched for years, is integration between our squad camera. No one was really doing that except WatchGuard. And even with I said earlier with the Vista, we didn't have that with the Vista. You'd have to operate both cameras independently. The V30 operates with our WatchGuard VR4 body camera. So when the squad camera turns on, the body camera turns on. When the body camera turns on, the squad camera turns on. So you have that synchronization without the delay, which is very important. So when an officer pulls up or is trying to stop somebody on a traffic stop or go on a call and their lights are on their squad, everything is synchronized, everything is fluid from several incident vantage points. And that's what we were trying to look for. And that's why I think it took us a while to find that right camera that did that. Because that's something that's very important. We didn't want to be operating on two systems. And right now with Evidence Library, I can go in and I can see the body camera, I can see the squad camera from one incident. And last night we had an individual with a mental health issue that was looking to end their life on a 12th Avenue bridge. And everything was synced between the squad camera, between the body camera, going up and talking to the victim. And the officers did a great job being able to, get the situation under control and get the person, the individual, the help that they needed. And so it was seamless from squad camera to body camera. Record after the fact. We can go back in time and capture video from events days after that they happened, even when a recording wasn't automatically triggered or initiated by the officer. That's something sometimes other cameras did not have. So we don't rely on just mere seconds of pre-event buffing to prove a case or to see what the video is. And so that's something that was very important that we were looking at. Our implementation. So we have 47 officers on the department, from me on down to the newest officer, Karina Lola, who will be starting here in another week or two. So a camera is issued to every officer, and we have several spares on hand. And fortunately, we do have spares on hand because we had some malfunctions with some of the equipment, and we're getting new equipment here probably by tomorrow. Again, they're matched to the in-car video system. The officer takes their body camera, they put it in a cradle, it automatically syncs after about 20 seconds. And so then both the squad video and the body camera operate simultaneously. One of the things we are also looking for is cloud-based evidence storage. So all the evidence is stored secure in the cloud-based. I think in the initial camera we were looking at, we were going to go to servers. Servers can get very expensive. Cloud-based storage isn't cheap, but it's secure, and we can use the data quickly without having to go buy additional servers. We updated our policy to make sure that the VF or the V300 was in that. Oh, excuse me, was in that. For some reason it kicked me off here. We made sure that the policy was updated to fit the V300. We had it initially to fit the Vista, so we just had to change the way the V300 operates. And then with Elisa starting, again, she specializes in data practices, redaction, privacy law is very important regarding video footage. All our video footage, both body camera and squad camera, operate under Minnesota Data Practices Chapter 13. And so we'll utilize our government QA data request management suite, which is going to expedite data practices for us compared to the old way we used to do it, which is more manual. This is more web-based, and we can fill those data requests quicker and get that information out. So I'm open for any questions that you have.
Thank you so much. Any questions from council members in the last few minutes? Sorry, Councilmember Troutman, are you trying to say something? Go ahead.
Yes. No, thank you. Well, I just wanted to thank the chief. Thank you, chief, for not just making this purchase, but making this this institutional investment, both in staff and in physical resources. And I also appreciate, I understand we're in the coming year, we're going to have, at least a couple more work sessions, specifically with public safety, and looking forward to that too. And so you guys have done an amazing amount of work in the last year, particularly responding to this pandemic. And so I don't think we can let any opportunity go by where we don't recognize that. Not just, and we know it's not you, it's all your officers. Not that it's not you, chief, but you know what I mean. That it's sacrifices that they're making, and so I just want to express my thanks for that.
Thank you. And I'd like to add, I know we're looking at a report from our city attorney, Martin Costello, on expungements and also pretrial diversions and also bail reform. We've been working on getting that report completed so that we can share that with the council, and with COVID in court, it's just taking some time to get that completed. And so I'm working with our city attorney, Martin Costello, to get that completed, and then we can present that to you.
Thank you. Councilmember Hayford O'Leary, I saw your hand up.
Yeah, thank you. I just wanted to clarify the event recording. The presentation mentioned that there is an auto recording and then otherwise officers manually trigger. What triggers an auto recording? And then my other question is, how long is that continuous recording that you're able to retrieve from Kept for?
Based on the incident, there are different retention schedules that we have to go by under the data practices. So we can go back and depending upon how long that is, it could be anywhere from 2 to 3 minutes to an hour. We would have to go in if the officer doesn't activate it, that probably would stay on the server probably roughly, and I'm going back to my data retention days, roughly about 90 days. If they go in and they mark it, and it has several fields that they have to mark, those data retention schedules are different based upon what the event is. So if the officer's having an interaction with a member of the public, such as a traffic stop, and he marks that, or he or she marks that, and that data will remain on file for 2 years. So if they lead to a case number, something that we have to assign, such as, you know, the officer's responding to a domestic or something like that, and they assign a case number, then it's 3 years. It's 3 years for the retention schedule on that.
Thank you.
Any other questions from council? Councilmember Whalen.
Just a quick thank you. The presentation and the talking through it's been really informative, and I know the city already put it on the Facebook page too, and folks had a lot of similar questions. I'm wondering if, I mean, obviously people can come back and watch the work session recording, but I'm wondering, and maybe it's even just chopping out this portion of it, if there's like a shorter video that we could have for the public, for, since I know a lot of folks have questions on body cameras, if that would be a possibility to make this information more easily accessible to folks.
Yes, the video I had was actually of the device itself and just sort of the options. We would have to look at the vendor to see what they would have as far as anything more in depth than that. And I think what we're planning on doing with Lieutenant Brad Drana and Neil Rulin, who's the city PIO, is sort of release on Facebook some weekly details and updates on what the body camera can do to keep people informed. So we just don't launch it and say, okay, here it is, but we're going to send out stuff on social media a week at a time just to say, okay, this is what the body camera can do and this is how it's done, so that people have that information.
Great, thank you, Chief. Any other questions from council members? I'll just add my gratitude to the police department, to Chief. This is a conversation that I believe, you know, we've been talking about body cameras before I started, but I remember when Mike Howard was on the council with us, and that was a conversation. So it just feels great to have this implemented. And in addition, you know, building out our staff and our team and our focus, not just in the police department, but across the whole city on equity and advancing racial equity in Richfield. And I am really excited to have Donna on board, William, to have Patricia on board, and take kind of a citywide approach in working with our residents to advance this trust and work here in Richfield. And I just appreciate all the efforts that the police has continued to do over the years and recently to advance that. And I'm so excited we have our body cams.
We're excited too. It's just, it's used to us getting to wear them though. That's the difference. I mean, they have to have them on each shift. I wear one. I'm not used to something on my chest. So, but they're great to have. The officers love having them. And you know, I come in every morning and I look at the video, and you know, like the incident last night I talked about, it's just great to see that great police work.
Absolutely. Well, thank you so much, Chief. I will call our session to a close, and I will see you all in a minute for the City Council meeting. Thank you, everybody.